tear trough deformity. Restylane did not treat the problem. I have uneven tear trough deformity. I received a Restylane treatment before, 2 weeks ago to be exact, and obviously that did not treat the problem. Would I be a candidate for surgery that can banish this? The doctor that did the injections said my under eye circles are a pigment problem. Is this true? It would be nice to banish the tear trough deformity in total. Any suggestions would be appreciated. Thank you for your time.
Thank you for your question. You've expressed a frustration with getting some Restylane and feeling like you still don't have a satisfactory result because of the appearance of your eyes and that your doctor had said it has to do with pigment. Well, the under eye appearance that is a combination of looking relatively hollow as well as looking dark is not an easy problem to manage. And I actually wrote an article years ago called Ethnic Considerations in Eyelid Surgery, and recognizing that there is a lot of different parts to enhance the area under the eyes when someone feels that their under eye area looks tired and hollow. So I think that the Restylane was still a reasonable choice to help improve the area where the under eye area looks a little bit hollow. But to help with the pigmentation is a very challenging problem. People who have come to my practice have often been frustrated with bleaching creams and other treatments, including retinoids, because essentially what they feel like is that the skin is so irritated that they can't even comply with the regimen. Now, one thing that we've had some success with in our practice is the use of platelet-rich plasma. And what we've been doing is we've been taking the blood, like a typical blood draw, and spinning it and concentrating the growth factors and the healing factors in the platelet-rich plasma and injecting it under the skin. Now, over the course of several months, the skin quality appears to improve. And that, I think, is a combination of the collagen remodeling and improvement, as well as the blood supply improvement to this area. So skin that is healthier always looks better. Now, in our own private line skincare products, we also have shown an improvement in skin quality just through the use of something topical, which helps to rehydrate the upper levels of the skin. And so combining these modalities, you'll probably see some improvement beyond just the filler. Now, if the area from the eye to the cheek is relatively hollow or shallow, then in my practice, I've actually added volume to the cheek area to allow a more natural balance to occur between the eyes and the cheek. You see, when people look at us, they look at the whole picture rather than the isolated parts. So if your goal is to look better and not to look so tired, this may be worth considering. So to summarize, a combination approach besides just an injectable is probably an approach that you should consider, and that the procedures that are needed may require more than one visit and a more longer-term treatment plan rather than a single solution. So I hope that was helpful, and thank you for your question.